So anyone tell me anything about prostate station? So it can come as malignancy or cancer, but exactly same approach. So when you know it, you know it. Yeah.
My internet connection is so bad.
Yeah, I can see that.
Did you tell me the scenario?
No, I'm just asking. Anyone tell me about prostate cancer?
Okay, prostate cancer, patient might come with some complaint like urinary complaint or some UTI features. So urinary complaints are like he might come with urgency, frequency, hesitancy, those problems, or burning sensation in urine, or difficulty in starting, like these things might be
Yeah.
weight loss, back pain.
Okay, good.
These are the
Good.
complaint.
Good.
So if it we have to like if he comes with back pain, we have to like exclude other cause of back pain. Like at that time we have to talk about like the DD should be pancreatitis, lung cancer, and like if there is any other cancer in other part of the body. Back pain means we have to also exclude the cauda equina syndrome. So, like
Yeah.
safety.
Yeah, that's good. Why pancreatitis? Pancreatitis, the pain is upper back, and this is very lower back. So,
Like no need to like tummy pain or something like that we can ask.
okay, but we can take pancreatitis off of the list. Yeah,
Okay.
yeah, but like neurological problem like cauda equina, okay, that's fine.
So if it is like patient comes with back pain, we have to exclude those things. And
Yeah,
if the
yeah,
patient has this urinary symptom, and so we can go this way, like talk about the urinary symptoms, and then we can just ask the basic cancer things like weight loss, tiredness, and
yeah. But even if the patient presenting complaint is a back pain, when you ask anything else, he will tell you obstructive symptoms of prostate. So all your DD now is disappeared from the list. You only ask about neurological symptoms because prostate cancer could cause a spinal problem and could cause neurological problem. But you don't need to go through your DD even if he presenting complaint was back pain, because when you ask about what do you have anything else, he will start to talking about urinary symptoms. They will take you to prostate now.
okay.
You
Then
can
we
save
just
your
need to
time.
ask this: Can you hold your urine and like bowel? To
Yes,
just
you can
exclude
ask all the obstructive symptoms, overflow, obstructive symptoms.
yes, yes.
Yeah.
And then we have to ask this previous, like all previous medical condition and
And
family
yeah, one
history.
of the question you have to ask as well, very important, sexually transmitted disease here. Because it
It's
can
also
come, yeah, yeah. So also you ask about, do you have any discharge or, yeah,
okay,
fever?
okay,
Yeah, because it can come with prostatitis as well.
okay, yeah. And
Gonorrhea.
then we have to like exclude this any problem with the urinary tract, like instrumentation earlier, or
Yeah,
family history. We must ask about the cancer history,
yeah,
and
good.
smoking habit. We have to ask, and how is his lifestyle currently. Like as it is a problem, is it impacting his life, or sleep problem, as it is like if he has this nocturia. So we have to ask about the sleep pattern,
Good.
and then we have to go for the examination. Examination means we have to examine the observation, tummy examination, and back passage examination. And after that, like back examination, they might give us dummy mannequin, and can check the mannequin and go according to this, or they might give us finding. If they give the finding, we can go the management, like BPH or prostatic cancer, whatever it is.
Okay, good. Okay. And investigation.
Investigation is first investigation. Like first, I'll do the routine blood test and urinary test, and we also do the special test for prostate PSA. And if the PSA has like some ranges, so if they give the PSA immediately, like for 50 to 69, if it is more than 3, we have to refer him, urgent referral. If it is like more than 2, in case of 42, 49 or 50, we have to refer. And if above 69, if it is more than 5, we have to refer. And if we find that there is irregularity, like DRE examination finding are consistent with the malignancy, we have to refer immediately, even if we don't need to wait for PSA event.
Yeah, good. Good. Excellent. That's it. Okay. Let's do it. So examination, as I said, if it is combined station, say just by inspection, you cannot see any redness, any discharge, any swelling, and then go to the palpation and comment like, I can appreciate the lump, side, service consistency, and tell the patient just, don't comment twice. Like if you comment, it's better to keep the comment when you talk to the patient. So tell the patient, thank you for examining me. I found a mass which is 2 by 2 centimeters, irregular, blah, 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 which indicate your prostate is enlarged. Or if you comment while you're examining, you told, I can appreciate a mass which is 2 by 2 and irregular in service, mobile, not mobile. You finish commenting, don't tell the patient again. Just tell the patient, I found your prostate enlarged, and then tell him about the next step in the management. Just like time management, don't do it twice, either while examining or just tell the patient about the finding. Okay, so let's do it. Who wants to be a patient?
I,
You are the doctor.
You're the doctor.
She's gone. Probably the line is disturbing.
Selena, hello.
yeah, I am
Okay,
here.
good.
I
Good.
can hear you.
That's very good. So your case, you are FY2 in GB, 60 years old male, has presented with you with some back pain. Please talk to the patient, assess the patient, examine the patient, and discuss initial plan of management with the patient. When they write in the task outside examine, it means combined station. So when you go inside, you will find the mannequin, so you will understand it's combined station. So your history has to be focused. Let's start. His name is Peter, he's 60, back pain,
So this
low
is the
back pain.
examination scenario mostly, right?
Yes, combined, yeah.
Okay.
Okay, I'll be the
Right.
patient.
Yes, thank you so much.
Hello.
Hello.
I'm Dr. Afroz Happy, one of the junior doctor of this department. Can I confirm your name and age, please?
Yes, doctor. I'm Peter, 60 years old.
Okay, Peter, nice to meet you.
Nice to meet you, doctor.
Okay, how can I help you today?
Oh, doctor, I have this back pain for over 3 months, and nowadays I'm unable to do my regular activities.
Okay, that's very distressful, so I think. Okay, Peter, can you please tell a little more about that?
Okay, what do you want to know, doctor?
Like since when you how is the progression of the disease?
Yeah, it is getting worse nowadays. That's why I can't do anything.
All right. With one finger, can you show me where exactly the pain is?
Yes, doctor, it is in the lower back. I think the central of the lower back.
All right. Does the pain stay all the day or it comes and go?
Initially, it was on and off, but nowadays I feel it most of the time.
All right. And have you seen anything bringing in your pain?
No, doctor.
And anything making it worse?
No, I didn't notice, doctor.
Okay, perfect. So from the scale of 0 to 10, can you score the pain where 0 is no pain and 10 the highest pain?
Yeah, I think it would be 7, doctor.
Oh, that might be very stressful for you. Are you comfortable to talk now?
Yes, it's all right.
Okay, do you want me to give you any painkiller?
No, doctor, I think I can manage.
All right. If at any point you feel uncomfortable, please let me know. I'll give you analgesic painkiller.
Okay, doctor, thank you.
All right. So, do you have any other complaint like any sickness, nausea, vomiting?
No, doctor.
All right. What about your micturition? Do you have any pain while passing pee?
No, doctor, not pain, but I'm going to the loo more often nowadays.
All right. And are you able to hold your urine?
I'm feeling a little bit difficulty.
Since when?
I think it's around the same time or probably a bit longer. I think 4 months or
So do you need to go to loo during night?
yes, doctor. Couple of times.
All right. Do you feel urge or rush to go to loo?
Yes.
All right. Tell me a little bit more about your urination. Like when you go for the pee, so is it how is the initiation of the urine? Is it spontaneous?
Mm, I do need to a little bit strain, but then it's fine.
All right. And at the end of the P, do you feel that you have at the end of the P, do you feel that it has been stopped passing?
No, doctor, I didn't notice.
All right. What about dribbling? Like,
What
have
is
you
that,
seen
doctor?
that? Like, have you seen that any drops of urine passing
Oh,
after
no,
finishing of your food?
no.
Right. Do you have do you have cough or any chest pain?
No cough, no, doctor.
All right. And how is your bowel habit?
It is all right, doctor.
Tell me about your weight. Have you seen any significant change in your weight recently?
Well, I didn't measure my weight, but some of my friends told me that I'm looking a bit thinner than before.
Right. How is your appetite?
Not that well. I nowadays I'm a little bit reluctant to eat.
Since when?
For 2 months.
All right. Do you feel dizzy or lightheadedness?
No, doctor. No.
Okay, let me ask you a few background questions to know the risk factor of your condition. Is that okay?
Yeah.
Okay. So, do you have any other medical condition like any chronic illness so far?
Mm, no, doctor. I mean, my sugar level was up, but since then I'm on diet. I mean, I'm not taking any medication.
That is really appreciable. You have managed your diabetes. All right. So, are you taking any medications or any over-the-counter drugs?
No, I just took some paracetamol for my pain. That's all.
All right. And what about your, are you aware of any allergy
No,
to any
no.
drug or any family history running in your family? Any any diseases running in your family so far?
I'm not aware of.
Okay. What do you do for living?
I work as a solicitor.
All right. So how are you finding working in your your workplace with these symptoms? Is it bothering you?
Yeah, I told you that I'm just now unable to do my regular activities. So it's the pain. I mean,
Move for examination.
Okay. So now I would like to examine you. I want to see your vitals, and also I want to examine your tummy, and I want to do your digital rectal examination, that is back passes of your bowel. Is that okay?
yes, doctor.
Okay. Before starting of the of examination, I would like to keep chaperone to maintain the privacy of my patient, and also I want to I want to explain my patient that this examination, how I'm going to perform this examination, and for what I like to see which condition I'm doing this examination. And also I will explain my patient what will be his position, and also the exposure. So for this examination, I would like to expose my patient from below waist, and also I want to tell my patient I want to keep my patient in lithotomy position. Okay, so in the first of all, I will take an overall view from inspection, if there is any rectal prolapse or any ulceration, any redness, swelling, or in his anus. And then palpation, after wearing gloves and with proper sterilization, I will introduce two finger, and that is horizontally I will pass it, and with two finger I will get some idea whether since from this examination I want to see the prostate gland of my patient, that is a male gland of reproductive organ. So I want to
Time's
see
up.
its.
Okay.
I want to see
Yeah,
its
you need to continue, but don't explain too much. It's combined, just do examination quickly. Yeah.
So I want to see its consistency, size, shape, mobility, and also if there. Okay, all right. So
Yeah. Okay. So you
from
found there is 2 by 2 enlarged prostate gland, irregular and hard, immobile. Talk to the patient now.
Okay, from the examination, I can see that, John, your male gland that has become 2 into 2 centimeter, and it has become hard. So from the history you told me so far, and from the examination, examination, I'm really concerned about your symptoms. That you have weight loss, and you have lost your appetite. Also, you this
So,
pain.
what is it, doctor?
Bothering. Sorry,
What is it?
what?
So, you have found something in my back passage. What's that?
From the examination of back passes, I can see that your gland that has become increased, and it is 2 into 2 centimeter, and the consistency is hard. So actually, the symptoms you told me and this examination, these are really making me worried, and I'm a bit concerned about this. For this reason, to ensure that I'm not missing any serious condition, that's why I would like to refer you to cancer service. Did you get me?
Yes. So, you're thinking that I have got cancer.
Actually, at this moment, without doing investigation, this is very difficult to say that if it is cancer or not. So what we can do, we will refer you, and the specialist will run some investigations. They will do some blood test to see if it is increased or not, and also they will they will do scan of your male gland. If it is confirmed, so according to the result and the stage, the treatment will be given. Did you get me? So
Doctor, yes, it's a lot for me. Thank you.
but John, I would like to reassure you, not all the patients, all the patients we are transferring to cancer service are not ended up with cancer. So just we are referring you to make sure that we are not missing something serious.
Okay.
All right. So I'm referring you to cancer service, and it is an immediate referral, and you will get appointment within 2 weeks of time.
Thank you.
All right. Thank you for cooperating me.
All right, doctor.
Thank you, Anika. Thank you, Selena. Okay, so in terms of history, it's very good. You cover your Socrates and your UTI symptoms and the obstructive prostate symptoms. And you ask about cough and chest pain. I didn't know why.
Actually, that if there is malignancy, like
Well, okay,
systemic
yeah,
reviews.
metastasis. Okay, no problem. Yeah. And you ask cancer symptoms and your all past medical history, and you started the personal history as well. So you cover the history very well. You can cut the personal, you can just ask smoking in when you're suspecting cancer, because we don't have enough time. Don't ask about diet, no. And the examination, instead you say, I'm going to tell my patient, your patient is already here. So just speak to the patient. Tell him, I'm going to do this examination. Is it okay by you? And by examining you, I found this. So don't say, I'm going to explain to my patient, telling him this. So the patient is in front of your eyes, speak to him, tell him,
So during this during this station, do I need to wear gloves and do the
no,
digital rectal
without gloves.
examination?
Just say, I assumed I'm gloved.
Okay,
All
and then
PLAB 2 station, no gloves. But you need to tell, just I assumed I'm gloved. Yeah.
and then I need to introduce a finger, like
Yes.
okay,
Yes, you have to examine and you will find the finding very obvious. Yeah.
okay.
Okay. And instead of telling male glands, just tell prostate. Everyone knows prostate.
Okay.
Yeah. Okay, good. And yeah, so this is the same like station